Good morning everyone, I'm Rowling Nunez and for today's video, I'm going to perform the postmortem care. So first, we need to ask the practitioner or other designated team member to establish the time of the death and determine if the practitioner has requested an autopsy. So, we need to determine if the family members or significant others are present and if they have been informed of the death. So, we need to identify the patient surrogate, next to kin, or durable power of attorney. We need also to determine if the patient has first-person consent is listed in the donation life, the donation life registry, or if he is her surrogate has been asked about organ and tissue donation. If so, ensure the donation request form has been designed and notify the organization procurement team per organization practice. So, we need to give family members and friends a private place to get together, allow them time to ask questions and to give. And ask the family member if they have requests for the preparation of viewing of the body, determine if they wish to present or assist with care of the body in order to decide and spend more time with their loss. And contact on spiritual care provider consistent with the family cultural belief and enlist a team member to stay with the family member who are helping preparing of the body. It facilitates respect and belief on the patient and the family. And lastly, we need to consult the practitioner's order for special care directive or specimen to be collected. So we need to prepare for the preparation, provide for the client privacy. If the patient has a roommate, explain the situation to the roommate and move him or her to a temporary location. So the equipment is PPE with gloves, gown, mask, eye protection, the plastic bag for hazardous waste disposal, wash bin, washcloth, warm water, bath towel, clean glove or disposable gown, and shroud kit with name tags, syringe for removing urinary catheter, scissors, small pillow or towel, and paper tape, paper bag, plastic bag, or other suitable receptacle for patient belongings to be returned to the family members, valuables envelope, and lastly, the denture cup if needed. So, the procedure is perform hand hygiene and don gown, mask, and eye protection. Means that we verify the correct patient using the two identifier, explain the procedure to the family and ensure that they agree to the procedure. Explain the procedure to the family and ensure that they agree to the procedure. Help family members notify others of death, notify the morgue or mortuary chosen by the family to transfer the patient's body. Discuss plans for postmortem care, and if the organs or tissue are being donated, follow the organization practice for care of the body. And identify and tag the patient's body, leaving the identification of the body. So, lastly, assess the general condition of the body and note the presence of dressing, tubes, and equipment. Note that do not remove indwelling devices when an autopsy is to be performed and disconnect and cup IV lines and remove indwelling devices. If the patient's denture do not stay secure in the mouth, place them in a labeled denture cup and ensure that they are transported with the patient body to the mortuary. Then use roll-up towel under the chin to close the patient mouth. Place a small pillow under the patient head and secure the feet and the hands of the body Position the hands in elevated position and the abdomen. Close the patient eyes by gently pulling the lids over the eyes. Closing the eyes of the deceased is form of showing respect and eternal rest. So we need to close it. So wash soiled body part. If family members are assisting with washing and providing postpartum care, instruct them to don gowns and gloves for protection from body fluids. So remove soil dressing and replace with the clean clean dressing. Remove soil dressing and replace them with clean dressing. And place an absorbent pad under the patient buttocks. And place a clean gown on the patient body. And brush and comb the patient hair and remove any clips and hairpin and rubber bands. We need to identify which of the patient belongings are to stay with his or her body and which are to be given to the family for legal purposes, and so you will be charged of theft. If patient's family requests viewing, prepare the patient body and room in the actual sensitive manner. Then place a clean sheet over the patient's body up to the chin. And remove unneeded medical equipment from the room. Provide soft lighting, and chairs for the family. Put chair at the beside of the family member who may collapse, and provide tissue and water for the family. Then allow the family time alone with the patient's body. Encourage the family to say goodbye with religious rituals and their culturally accepted manner. Do not rush the grieving process. Do not force family members to view the patient. Remain accessible to address need and answer questions. After the viewing, place the patient's body and shroud provided by the organization. Place identification label on the outside of the shroud. Follow the organization practice for marking a body poses an infectious risk of others. The prompt transportation of the patient body to be mortuary has been arranged. If a delay is anticipated in the transfer of mortuary care, transport the patient body to the morgue. Discard supplies, remove personal protective equipment, and perform hand hygiene. And lastly, we need to document the procedure in the patient record, the time of death, description of any resuscitative measure if applicable, and name of the personnel certifying the death, and lastly, any special preparation of the body for autopsy or organ and tissue donation.